Wow, how many people showed up today? This is pretty good. Guys, I'm so grateful that all of you are here today. This is truly an amazing opportunity for the state of West Virginia, and I'm so proud to be here to brief you on the application that we just filed with CMS to have transformational healthcare outcomes in our state. And I want to, this is big. You know, this represents a very exciting new chapter for West Virginia in our efforts to really strengthen the health and well-being for all West Virginians and to use that as leverage to grow our economy in a way you've never seen before. This is a unique opportunity and something we're going to be doing right. You guys may remember back in March that I unveiled a bold 4-pillar plan designed to make West Virginia a healthier and more vibrant place for everyone to live, to work, and to raise a family. I'll be honest, when we announced it, I couldn't have imagined the momentum that we would be building. But thanks to your help, a lot of people in this room and a lot of the leadership within the administration and the support of the legislature, I always want to give credit when they're doing really good things, those 4 pillars turned from a plan into a movement, focusing on cleaning up our food. We know the importance of that. Thank you. Finding purpose and finding health, ensuring that people are working and they could have longer lasting lives. Helping people move their body, changing their life, being around a little bit longer for your friends, your family, your neighbors. And also different ways we could reward healthy choices that get to some of the SNAP question. Glad to see the Commissioner of Agriculture here today. He's participated in this effort. He's a good man. Each of these initiatives found a life of their own, and they've been gaining traction, especially the Mountaineer Mile Challenge that you're beginning to see all across West Virginia. Across our state, people are lacing up their shoes, tracking their steps, and taking control of their lives through fitness. I'm going to have some personal stories to tell you about that as well. But I want to tell you, for everyone who's taken up the challenge, I have been right there with you. In fact, I'm proud to share that over the last 6 months, I've been averaging over 12,000 steps per day. And as of today, I'm down at least 12 pounds. It's a start. Long way to go. And I'm not perfect. I've been clear about that. But I'm going to try my best to lead by example and show it. If I can do it, I think any West Virginian can do it. We've also made great progress on the pillars that we laid out. I think the work of the legislature and what we're doing to clean up our food, it matters. That effort to get the dyes, the unhelpful dyes out of our food, not only did that help West Virginia, that's the start of a growing national movement to clean up our food. And so that Make America Healthy Again movement, a lot of it starts right here in West Virginia. For me, this is about improving the meal quality and the building healthy habits from the beginning, starting with our kids. We also know that we want to emphasize work. That's central to the success of this administration. I've always said the single most important issue that we need to work on as a state is to grow our workforce participation, to get stronger. Rural health transformation matters because if you could get people healthier, you can see it's going to be a lot easier to get them back into the workforce. And think about what that can do from an economic perspective. We've been able to secure a waiver from USDA to eliminate the entitlement to sodas under the STAT program, and we're going to ensure that taxpayers' dollars are spent on nutritious options. That's real progress. Today, though, we take a step forward in another area. By submitting a rural health transformation application, we have a chance to truly engage in innovative and generational change for our citizens. The federal government, through the Big Beautiful Bill, championed by President Trump, that presents us with a once-in-a-lifetime opportunity to change the health narrative that's been carried around our rural communities for far too long. As a result of this application, West Virginia could receive more than $100 million a year, every year for 5 years, which could really play a fundamental role in transforming healthcare for our state. It's going to help make West Virginia more affordable on the healthcare side and more accessible for our citizens. Let me repeat that. It will help make West Virginia's healthcare more affordable and more accessible for our citizens. Today, I'm going to walk through some of the details of our submission, and we're going to have some summaries that we're going to be providing to you after this. We want to make sure that healthcare outcomes are the very foundation of the economic strength that we're driving in West Virginia. West Virginia is going to confront the barriers directly that keep West Virginians out of the workforce. I've mentioned it before, I'll mention it again. Poor health is the single largest driver of low labor force participation. We have one of the highest disability incident rates in America. We have to address that. And that's why improving healthcare outcomes must be a primary focus. By investing in prevention, the state's going to restore some of its working age population to health and more productivity. The plan that we've submitted focuses on 7 core areas. It starts with the connected care grid that's going to bring healthcare access directly to the people, both in person and digitally. When I say that, it means easier to get to a local provider or easier to access that provider through telehealth opportunities. A key focus of this work is going to be building an integrated data system that's going to allow for real-time analysis and improve patient care coordination. As part of this work, we're going to support EMS treatment in place programs that will help reduce unnecessary emergency visits by allowing some of our patients to be treated in the comfort of their own home. Our second initiative builds on a unified one-stop health mobility platform that connects medical transportation, public transit, and community ride programs. Transportation's always been a big challenge in West Virginia in terms of healthcare access. We're really trying to address that in this application. The initiative is going to fund vehicle and driver grants. It's going to help expand local and regional transit capacity. I'm going to work to coordinate with EMS and hospitals and providers to create efficient, data-driven transportation that lowers costs. Once again, affordability for West Virginians. That's critical. Third piece is actually something we've been working on in my administration from the very beginning. Our plan is seeking to attract top-flight clinical talent while training and retraining West Virginia's own future providers through a Mountaineer Care Force. This is going to involve a lot of early outreach and educational work to bring more West Virginians into the healthcare workforce. We have to expand rural residencies, fellowships, and training sites for key provider areas, and offer incentives and return-to-home scholarships for clinicians serving in rural areas. Recruit, retain, retrain. Recruit, retain, retrain. Let's keep practicing that over and over again. We're going to support faculty positions in community and technical colleges, and I'm grateful for all the wonderful work you've done, Sarah. She's been a good contributor to this process. Appreciate your top-notch work. We need to do that to grow training capacity, to launch apprenticeships and entry-level healthcare jobs through our learn and earn models. And I think there's going to be a great chance that we can use this application as an opportunity to really move the needle on the broader workforce participation issues that our administration's focused on. That's the key to our success. Right now we're last in workforce participation. That must change. And I am so happy to work with the legislature to address that issue more and more during the next legislative session. So critical to do. Our next initiative focused something we call Smart Care Catalyst. And this is an effort to help some of our providers and our hospitals and rural clinics get up to date with the new technology, helping seed those opportunities to do things they otherwise wouldn't be able to afford to do. We'll help them save money through some of our value-based care initiatives we're going to be working with them on, and we want their enterprises to run more smoothly, to create opportunities for them to engage in more shared service arrangements, perhaps including buying supplies together. On top of that, we have to change how we pay for health care. That's important, that we reduce cost. Instead of just paying for how many services are provided, we'll focus on paying for good results and quality care. We have to work with the insurance companies and the healthcare providers and consumers to create those new payment systems that reward quality, and we'll help our rural providers learn how to use those new systems as well. Our fifth focus involves the creation of a health to prosperity pipeline that's going to connect recovery, readiness, and employment programs to help West Virginians find work. Healthcare and economic issues go hand in hand, and we need to make sure we constantly are keeping that front in mind. This is going to include expanding health to work initiatives, recovery to work initiatives with care, job coaching, and employment support. It's going to include partnering with employers and workforce boards to fund on-site wellness and preventative programs, incentives to managed care organizations and employers for transitioning individuals off of Medicaid into commercial coverage, and tracking employment, retention, and healthcare outcomes to demonstrate the long-term relationship between healthcare and economic impact. Our sixth initiative, we're calling it our Food as Medicine focus, big part of the MAHA efforts. We're looking to empower West Virginians to lead healthy, productive lives through programs, education, and rewards for exercise and wellness activities. We're working to grow programs to help people be more active and to support caregivers. And of course, we want to provide some help to allow that to happen. We're going to be focusing on support for moms and infants and youth and the elderly as part of our chronic disease prevention initiatives. We have to tackle the many chronic diseases where we're not faring well today. And we're also going to work with schools, with employers, and local organizations to make healthy living a big part of our everyday life. We have some interesting healthcare challenges that you'll be seeing and we'll be talking about going forward, including ways that we can improve what's going on in the schools and in the counties, bring back the presidential fitness test, and emphasizing the importance of movement in our schools, in our counties, and engaging in friendly competition to make sure that all West Virginians are engaged. Finally, we have an initiative called Health Tech Appalachia. This is really an exciting opportunity because it's trying to grow new healthcare solutions that can also boost our economy. We're actually going to be setting up new healthcare, working with companies who are developing new healthcare technologies and provide resources and tools for people relying on artificial intelligence, digital health, and consumer-focused solutions. We have some gems in West Virginia, and I don't want to single too many people out because I'm going to make everyone mad at me, but some of the work being done at WVU and Marshall and the O School is pretty unbelievable. I was just recently up at the Rockefeller R&I. What they're doing is world class. It's at the top of its game. We need to be supporting those initiatives, and I think that's going to make a big difference, not only in terms of healthcare outcomes, but also the amazing economic opportunities that are there. There are things they're doing that can be commercialized that can lead to significant job creation all across West Virginia. It's really, really exciting. So we have a lot of work to do, and we're looking to work with everyone here in this room, with universities, with investors, with consumers, with healthcare providers to build a strong system for innovation in our rural communities. Now, in closing, I want to let you know that this was a process that was very inclusive. We tried to reach out to everyone for their input, and we received a lot of input. We had a number of direct meetings with many people, some in this room, and we engaged the public significantly. We did a statewide RFI where we generated nearly 3,000 pages of content and insights. I can tell you that I did read many of them. There were a lot of binders that were put together. We convened 3 roundtables with over 36 organizations, hosted a teletown hall with more than 17,000 residents attending to speak directly with rural West Virginians about this application. We structured our application to have sustainability, and we emphasize accessibility and affordability. We know that this plan's not going to end at the completion of a grant cycle. We think it's going to build out and enhance our infrastructure and programs that will strengthen healthcare in our state and that will reward results, not volume. A couple administrative matters. We have wonderful groups of people involved. I know that we have our transportation secretary here. We have our deputy secretary of commerce here. And of course, up here with me, we have our secretaries of human services and health. They're all going to play a very important role to make this happen. I've also designated our Department of Health to take a lead in implementing this plan, but everyone's going to be very heavily involved in this. We have a lot of talent, and they all contributed to make this a top-notch application. I want to thank everyone on our team for the long hours that were put in. People were spending late nights, and I'd like to think that West Virginia got a little bit ahead of the curve with the work that we did and the approach that we took for this process. To the providers, to the stakeholders, and everyone here, I want to thank you. A lot of this plan is a reflection of your ideas that you provided to us. Now, this was an interesting process. We had to put something together in a very, very short period of time, but we did that through your work. We know that the input you've put in has been critical, and your ongoing engagement is actually going to be critical to the success of the measure because the implementation period begins now. We need your help. To gain a competitive advantage over all the states that you touch, you have to move faster than them. So I'm asking everyone here and everyone across the state, as we begin this, some of this information starts to go out there, to work with us as we implement. We're going to have a number of conversations with CMS and others as this process begins. There's a new process now. We submitted it. Now we're going to try to continue to make our best case for the application and to maximize the dollars that come in. So you're going to get a lot of information today. Be patient. We intend to publish the application. We'll let you know of that date as it's available, but we do have to keep engaging with CMS to make sure we're protecting our application and we're having the best score possible. So we want to have more discussions with them because we want to score the best on the test. So I want to let you know that because I want to anticipate those questions, but the public will get this document without a doubt. Thank you for believing in the efforts that we put forward. I want to take a moment and just mention some of the people that have signaled their support for this. First of all, I want to thank the federal delegation. We have received support letters from our federal delegation. I applaud them for that. I know that we've seen support from our House Speaker and from our Senate President. I'm supportive of that. I know there are a number of wonderful legislators here today. I want to thank you all for coming and for providing your input. I mentioned the Agriculture Commission and his support, Department of Education, Higher Education Policy Commission, AARP, you're here today. Thank you for your help. Boone Memorial Health, Center for Rural Health Development, Home Care Association of West Virginia, Marshall and WVU and Rockefeller Neuroscience Institute. I mean, I could go through the whole list. We have over 40 letters of support from folks because I think people know this is a chance to truly be transformative. I believe West Virginia is going to be the model for the country in terms of how we're doing it. We handled this process right. If ever there's a state that will benefit from the Rural Transformation Fund, it's West Virginia. And we want to show the country what we can do by being thoughtful and being collaborative. Because one thing we have in West Virginia, we have a lot of things, but one thing I know we can do, we can move quickly. And we're going to put in place thoughtful solutions that then could be used to turn the key, unlocking opportunities to grow economically, and that's key. You have to have a strong economy to attack problematic healthcare outcomes, and you have to have good healthcare outcomes to grow a strong economy. We plan to keep building on those efforts and leveraging technology, investments in workforce and our people, and we're going to keep challenging everyone to take advantage of this nice opportunity that President Trump has delivered to us. So, thank you for all your incredible contributions and all the folks that weighed in. Now, what I'd like to do is to give our cabinet officials an opportunity to say a few words. I'll start with you, Dr. Singh. Thank you.
Good afternoon, everyone. On a personal note, thank you, Governor. Thank you for entrusting us, thank you for entrusting me to be a part of such a vital project and program for this state. It's truly an honor. Today's submission marks a very important step for West Virginia's future. The Rural Health Transformation Program is not just about healthcare, it's about rebuilding the foundation of health, work, and community across our state. This plan invests in prevention, local innovation, from expanding virtual care and remote monitoring to improving food access and chronic disease reversal, to growing a homegrown health workforce through programs the governor mentioned, like the Mountain State Care Force. It uses data and technology to connect care, cut waste, and measure real results. And that's the key, to measure real results and progress for this program. We're hoping to have fewer hospitalizations, better access, and stronger local economies. We and I am deeply grateful for Governor Morrisey's leadership on this project and this application, and the many partners who helped us through those long nights to shape this application, many in this room as well. Together, we're proving that West Virginia can lead the nation in showing what rural transformation truly looks like. And like we say at the Department of Health, stronger lives, healthier choices, a better West Virginia, and a brighter future for every Mountaineer. Thank you, Governor.
Thank you. I'm grateful for all of his work, and I'm also very appreciative for Alex Mayer, who's doing a great job. Talk about a guy that's got a big portfolio. He's got a lot on his plate. Alex, love to hear you for a couple comments. Thank you.
Appreciate it. No, thank you, Governor, and good afternoon, everyone. I want to begin by thanking the Governor for his leadership and vision in advancing this critical initiative. I also want to express my appreciation to the many stakeholders, community members, legislators, associations, and partners who have shared their insights, perspective, and ideas throughout this process. While the pace of this effort was definitely swift, it is grounded in collaboration, urgency, and a shared commitment to strengthen West Virginia's rural health system. Today marks a significant step forward in West Virginia, one rooted in the belief that where you live should not determine your healthcare outcome or the care you receive. The Rural Health Transformation Program represents more than a new initiative. It represents a renewed commitment to the people and communities that make our state strong. Across West Virginia, we know the challenges rural communities face, but we also know the incredible resilience and ingenuity that define these same communities. This program is about meeting that resilience with investment, innovation, and partnership. Through the Rural Health Transformation Program, we are working to ensure that rural hospitals, clinics, and healthcare partners have the tools, flexibility, and support they need to deliver critical services so West Virginia thrives. This isn't just a health initiative, it's a community initiative. It's about ensuring that every child, every family, and every senior in West Virginia has access to the care they need, not just to survive, but to live well. Together, we're not just transforming healthcare, we're transforming opportunity for rural West Virginia. Thank you.
Well, thank you very much. So many people have contributed so much. I do also want to point out, because a lot of the work gets done by people behind the scenes. I don't know where Jack is and Kurt is. And let me tell you also, the team at McKinsey did a great job, Chris Jones. There's so many people that contributed. And I want to make sure everyone knows that we've got a powerhouse team working on these issues. And I may be up here at the press conference, but the credit belongs to everyone who's putting in the long hours to make this happen. So let's give a round of applause for our team. One final comment. We know we're talking a lot about rural health care today. If we do this right, this is an economic initiative and economic development in a way that we haven't seen before. I've had a lot of conversations with people who know that when you're getting this kind of investment, we don't know the final amount that we're going to get, obviously. We believe that the statute will provide what we think will be the minimum of $500 million, but it's up to CMS. That's why I have a little patience. We want to take this support and hopefully translate it and make the case to CMS and to HHS why we have the best application around. So give us patience on that. But the opportunity we have is incredible. When you talk about investments of this area, $500 million, and let's say you get private sector matches and other contributions, you might be able to multiply that economic effect on your GDP by 2.5% or more. That's great. That's the kind of thing, pouring more capital investment into our state that makes a big difference. But to do it, not in an ad hoc way of taking federal money, throwing it on the wall, hoping it's going to fit, but very structured and focused on the fundamentals. That's what we're doing to advance economic development. And I urge everyone who cares about economic development to come into our office and work with us. This initiative is a good example of how we're trying to get the fundamentals to work with us, for us. The truth is, we had some real challenges in terms of healthcare outcomes. And as a rural state, we don't need to talk about the many things we have to overcome. But in those challenges lies opportunity. And that's why we're here today, to take advantage of the strengths that we have to overcome those problems and lead it to long-term improvements in standard of living, economic strength, and affordability. So I'm really happy to be here. This is a big deal. I'm happy to turn it over for any questions. I'd like to start by focusing on rural health. I'm sure I'm going to get a question about another topic, and I'm happy to answer that. But let's start with rural health questions. Erin.
Okay. So I first want to talk about collaboration, but then I also did hear you talk about like the significant number of like public comments that
Sure.
you did get as well. So since the state could only make a limited number of proposals, which groups and people had the most influence into the process and why?
I think the public at large had a great deal of influence in the process. It was open. It allowed people to submit a lot of material. We had over 3,000 pages that were submitted. We tried to make ourselves available. We announced it in advance. We took a lot of meetings. We tried to provide information to people, and I think that's very positive. So it was a very inclusive approach, and I'm proud of that. And we tried to work collaboratively with the legislature. Sometimes these projects are difficult because we had to put it together in such a short period of time. You have to take charge and run with it, but you do want to get the feedback. We've gotten a lot of feedback and had very productive meetings broadly with consumers, with legislators, with all the stakeholders involved. I'm proud of the process we have and appreciate it. Next question. How are you, Lori?
Good. Lori Cruzy, West Virginia
Yeah.
College. We've heard from policy analysts and from hospital executives about how much funding the state will lose from the Big Beautiful Bill as a whole. $1 billion a year when it's fully implemented. How do you see this program or the state addressing, if not this program, but then
Yeah.
the state addressing that loss of Medicaid funding that might lose?
So I think that the loss of funding, and I've addressed this before, and there's some different perspectives on this, there's a lot that's speculative about what will happen. One of the reasons these estimates come in is because they make certain assertions about the expectation for hospital visits or what type of health you're in. Part of the goal here is to be transformative and to make a big difference in the healthcare outcomes of our people, whether we're talking about diabetes, whether we're talking about COPD, whether we're talking about a lot of disease states. And if you're successful in that regard, by investing more heavily up front, you can save a lot of money at the back end. That's the goal behind it. I think that's President Trump's vision. That's my vision behind this. That's what we're working to do. So I don't think the future is preordained based upon what some experts have come up with when we're the ones putting the application together. We're the ones who are building this infrastructure, and I think it could be very helpful. Now look, I'm not going to dismiss the concept that there is change that comes in to these bills, and we're going to deal with it the right way. And I want to make sure that we're protecting West Virginians. That's my goal. But I would ask that people focus on the very positive parts of investing so much. We've never seen, I think in the history of healthcare, the kind of forward-thinking, proactive, preventative investment that President Trump engaged in, period. They've never seen this. We're talking 50 states with an opportunity to have a minimum of 500 million each, and you could get a lot more. They've never had that before. And I think that's something that should not be discounted. So a lot of the people making the estimates are just assuming everything's going to be static. We want to improve, and we want to make sure we're growing our workforce participation. If we could just succeed on growing workforce participation, that alone makes a big difference. We might be able to get some of the people who are currently on Medicaid, move them over on the commercial side. That's certainly the goal. And then that saves tremendous amounts of dollars. But we're also in this application trying to anticipate that we want to help our healthcare providers and systems operate in the most effective way possible, value-based care. That makes a big difference because that allows them to be better positioned to deal with changes that may be on the horizon. So I reject the notion we should accept some static, analysis that doesn't factor in all the change that we're going to be doing, not only through this application, but more broadly through the economic development initiatives that this administration has made as its priority. Every day, we're talking about focusing on job opportunities and affordability every single day. I know a lot of people want to write about different things. That's what we spend 99% of our time on. I would ask that maybe some people cover that, and I think there's a lot of good stories out there, but thank you for your question. Questions? Back there? All right. Aaron.
Okay, so I know I heard you talk about support for healthcare providers in general, but I also did hear you say, or one of you mention, a need for fewer hospitalizations and then also EMS care at home. So I'm wondering if that would equate to a need for fewer hospitals?
So I'm not going to make a prediction on what will happen other than there's a great opportunity for our hospitals. It's a great opportunity for our federal qualified health centers. It's a great opportunity for a host of different healthcare providers. But we have to be thinking from a transformative perspective in terms of opportunities we have so patients get better access to care. So this is an opportunity to grow access. So there'll be more opportunities for provider visits, either directly where the patient is going to go to get the care that they need, or to be able to access it through telehealth. That might occur through a hospital, might occur through a clinic, it might occur in a variety of different situations, but it's putting the consumer first at the equation. So I'm very hopeful that a lot of people are going to really like what we're doing because it's transformative. Now, obviously, change happens in any proposal, but this is a great opportunity, and it's a strong net positive. So once again, we're focusing on the positive things that are going to happen through this. Thank you. Lori.
Can I ask you a SNAP question?
Yes. Any more rural health? So now we move to SNAP. We kind of guessed that these questions are coming, so please.
Okay, we learned today that other states using Fidelity have received instructions on how to set up a fund for SNAP and begin doing so. Can you clarify at this point whether you intend to fund SNAP or what you're looking into?
So let me be clear, and I want to make sure, because some of the publications have been putting inaccurate information out. that we have been funding initiatives to help ensure that West Virginians don't get hungry. Let me say that again. We are going to make sure that no West Virginia goes hungry. Period, full stop. So these people that start to create narratives that say something else, it's not true. Now, we have been looking very aggressively at the vendors. And to be honest, I've been very disappointed in some of what I've heard back from the vendors. It's our understanding that no state that we've known about has been able to kind of do what some of the other states, there's one through Conduit that may be doing different things. Virginia has a different vendor than West Virginia. There are 36 states with our vendors who we're kind of in the same position of in terms of the inability to just load up the card. That's why I've said it's feasible. So we have been pressing them very aggressively to see what we can do, but we're one of 36 in that regard. So I feel comfortable to say we're in the same place as all those 36 states, not ahead. But I would argue in many areas we're way ahead of them. Here's why. Because we did a few things. We got out in front of it, and we're monitoring the situation. I've already committed a minimum of $14 million in terms of money to the food banks and to the food pantries. We've also activated the Guard to make sure that no citizen goes hungry. So we've done that. Tomorrow, I'm going to release another $2.5 million as we move this up toward the $14 million of commitment. And depending upon what we hear about the dysfunction in Washington, whether the government's going to reopen again or not, that could dictate in the upcoming days whether we call the legislature back into session next week. But I'm going to do it based upon information available. But I would urge everyone to talk to the food pantries, talk to the food banks, ask what the collaboration has been with our office to make sure that no one's going to go hungry. That's what matters to people. What matters is that people don't get hungry. What matters is West Virginians stepping up. But in terms of the contract, look, we want the government to be reopened. A full opening, I think, would be the best scenario. And then we can load our data and get benefits flowing immediately.
Are you saying you don't want to fund SNAP directly?
No. So I know what to hear as you say it. We're helping people. And that's important. We're not saying we won't fund it. What we're saying is that it's been infeasible on the part of the contractor to do it. And if you ask around, and there were errors in reporting recently on this, if you ask around, people said, oh, it can be done. No, it's not feasible. And I believe, to the best of my ability, and I just got briefed on this about a half hour ago, that every one of the 36 states is in the same boat, so that it's not feasible right now. If the government reopens, then it may be feasible. Now, I will tell you, Lori, we are pushing these vendors. I want them to move like the wind, and we're being very aggressive pushing that, because why should one vendor be able to do it and another one not? So it's a fair point for the public to ask, but I would also say look at the other 36. If there's a solution that's coming up through one of the states, we're all ears, right? But right now, we don't think we have that option. That's why what we've chosen is the single best option to keep people from getting hungry. I think that's the important point. Any questions on SNAP? Any others? Well, look at this good crew. So listen, I want to say thank you very much for coming here today. A lot of positive things that are going on, and I am appreciative. But now we have to roll our sleeves up and get to work. But once again, thank you to everyone for all the work you put in. Thank you to these wonderful secretaries and to our whole team. And we'll be out on the road talking a little bit about rural health care and SNAP, of course, in the upcoming days. And we're happy to follow up. And I would notice, as we get updates on any of these issues, SNAP included, Lori, we're happy to let you know, because we're just basing on the information we're getting. So thank you all. God bless.